Hello everyone. This is a very nice topic and I hope a lot of people get interested. We just have a patient that said, you know what, I'm gonna take all my teeth out and I'm gonna put implants and a denture on top. Because I saw a billboard saying, get your implants and your new teeth in one day, which means they will extract all the teeth of this patient. Doesn't matter how young it is, if they're younger or older, they don't care, they think, why do I need to keep it? It's too expensive, which is not. You just have to brush, floss, take care of whatever problem you have, and that's it. So I decided, and a lot of questions have happened in season 1 where people said, can you talk about how important are our teeth? Number 1 is the first step you take for our food, our digestion. The mouth is where we forget about if you have a nice smile or not, if you want to have a good one or not. People say, oh, I want to have like smile like you, doctor. Well, this is genetic, it's from my mom and taking care since I went to dental school. So this anterior teeth, which is not only for the look, is because they have a function to cut. And when they cut, it's not to cut very strong surfaces, like not for ice, we're gonna have a topic on that, not for chewing ice because you will crack your tooth, and the way you crack it, in molars, which has the strongest one, is from a small crack to a big fracture. So what do we do in that? We don't chew ice, we have to take care of them. Many people doesn't know that 60% of the population in the world has dental cracks. I will show you an image. But you will see like a line. Sometimes you don't see this line that you can appreciate here on the camera, and I know you can see it. This is a small line, and then patients don't see it. These lines can be in front of the teeth sometimes in this area, and they think, oh, it's the normal part, right? No, it's not. Or they can actually be in this teeth, and you can have, I can even put a line in here. I don't know if you guys will see it, but it can be like a line, like a hairline in this part, and then you see, oh, I don't have anything. I will show you some images that you will see with the cracked teeth, or this one where it's more dramatic, where it's completely fractured, that I will show you in this teeth. So these front teeth have to be carefully taken care of it. Some people have this bite, some people has another bite, border to border. So it's better that you see an orthodontist, which is a specialist in braces or Invisalign. To fix your smile, don't do veneers, don't do crowns because you want to fix it. It's cheaper and better if you see an orthodontist will fix and straighten your teeth. But these teeth, as strong as they are, they're very delicate. They're only one root. I will show you a picture of that. And I will show you a video that you are gonna like it, where it's a tooth while I'm talking, and you will see inside all the structure. I show it in another show, it was a gift. So when you're talking about this anterior teeth, is the canine is the stronger. These ones are strong too, but I tell you they are to cut only. But to chew is all these teeth. The ones that are gonna use the most forces is the most important, is the first molars. So when you're chewing, you do like a circular movement. So if you are grinding the teeth, you have to take care of it. This is how do you take care of your teeth? If you're grinding or you're clenching and you're tightening, you're gonna create cracks, and what is gonna happen? You're gonna fracture the teeth, and once you fracture the tooth, you cannot do anything, depending on how big is your fracture. So if you have any problems in these teeth, it's very important, all of them to be safe. The wisdom teeth, these are the last ones, it's not that important. But the first molars and the second molars are very important. Let's say for some reason you lose the second molars, then you still can survive with the first molar and the 2 premolars. Because you need a balance. It's like not having a leg. It's like, okay, I'm gonna take one of my legs because it's broken. No, you don't do that with your teeth. Try to save your teeth as much as you can, because anterior have to use for cutting. I will tell you to do this, I will tell you this advice. Cut your apples to the point that you can bite them in the side with these teeth, you have to use these teeth and bite with these areas, okay? Because you can almost don't clean well the wisdom tooth. You can take them out unless you have a big space and you're sure that you are cleaning that tooth. And the tongue has importance too in the cleaning during the we're talking. So be sure you're cleaning it and brushing. But the premolars, they're more fragile. They have two roots, but they're helping us to chew the food, and these two molars. So the strongest are this and the canine. Be sure that you are protecting them. If you're grinding or clenching, ask your doctor. They will make a night guard. That is another topic. But for now, you have to remember, these teeth can fracture just like these teeth. You just need, even if you don't have caries like this, you will have, remember, you will have broken tooth if you have an accident, a hit. We talk about that in trauma. But if you have decay, it's easier to break. If you're chewing ice, my dear, it's also easy to drive. It's another topic. But the night guard, we're gonna talk about that because it's so important that if your dentist do it, you have to be sure that your dentist will adapt the night guard to you. Some patients are happy using the night guard of the pharmacy, but sometimes it can modify the way your bite is, and you ended up changing your jaw, the way your jaw is, articulation at the jaw is, and then you can end up having a problem even with balance. I remember Dr. Paulo Becerra telling me that he does a certain night guard that helps him with the balancing of certain patients and equilibrium, etc., between and other things. So be sure that you take care of all your teeth. The front, why the front are kind of the weak and the show, right? But if you don't like the way you look and you break the tooth, okay, they're gonna make a crown. But if they do a crown, don't think for a second it's forever. If you don't brush and floss, and the crown has to be perfectly adapted to your tooth without anything that is stopping you to cleaning. If the floss is getting stuck, that's a problem. So now I hope you understand the function of every one of the teeth. The front teeth are for cutting and the posterior are for chewing. Remember one thing, if you have a root canal on the anterior teeth, you don't need a crown unless the tooth is destroyed. So if you have an accident, you have to wait 14 days before you do a root canal. But these teeth are very important. Please, I just heard about a patient that has internal resorption, and it's a case that's so easy to save. And I hope the surgeon who struck this tooth is listening to me and think about it. He has to study root resorption. It was internal resorption and the tooth was extracted. When you are at the dental chair and they said right away, this tooth needs to be extracted, run up the office, get a second opinion. No matter how much trust you have to your dentist, be sure that tooth is so destroyed that has to come out of the mouth. If there's any chance you can save it, because it's in front and it's very difficult to restore. Sometimes the implant doesn't get there. So I hope you have these questions. We have answered your questions. If you have more questions, send them to Instagram. Subscribe to our channel, Dr. Fanny Yackaman, and follow us on Instagram and TikTok. Thank you. Have a good day. Bye-bye.